Go ahead, please.
Hello, thank you, Mr. Chair and members. This is Jordan Lindsey with the ARC and United Cerebral Palsy California collaboration, representing people with intellectual and developmental disabilities and their families and our chapters throughout the state. First, I just want to really thank Assemblymember Ting for his questioning about even the depth of these cuts and if there are ways that calculations could be redone so that we don't even have to have the severity of these cuts. Also, thank you, of course, to Assemblyman Frazier and Assemblyman Mathis for your continued commitment and your comments regarding the intellectual and developmental disability community. And thank you, Dr. Arambula, for discussing the importance of our pandemic response and the importance of not letting budget cuts impact our pandemic response. And it is exactly the pandemic response in the developmental disability community that I want to quickly discuss. The CDC has recognized our community as especially vulnerable to this virus, and in response, families, direct support staff, service providers, and regional centers have done heroic work to protect our community. Additionally, as a result of closures to early intervention services, special education, and day programs for adults, we're experiencing in our community a subsequent crisis for babies, students, and our families, which is a crisis in a deterioration of mental health, physical health, and family health right now. And similarly, in response to that crisis, the direct support staff across the state are the first-line public health service providers, and again, doing heroic work. This budget, however, says to these heroic efforts, thank you, and now we're going to cut 10%. We're going to fire 10% of this direct support staff, and we're going to increase waiting lists for services by at least 10%. That's the response that this budget says to these heroic efforts. On top of the 10% cut, I really want to emphasize and talk about the uniform holiday schedule, aka the furlough schedule. This tells families that we know you may have used up all your paid time off of work for the last couple months. You have been with your adult children, caring for them, but now we're going to eliminate 14 days of your child support so that now you have to take off work off again 14 days a year to be with your adult child. This makes no sense in a response to this pandemic. Additional concerns with the cuts to IHSS, and we align our comments with those that you've previously heard. And we strongly oppose the elimination of CBAS, especially during the pandemic. Individuals with intellectual and developmental disabilities who use CBAS settings do so for very unique reasons, and those individuals are almost assuredly going to end up in nursing facilities, which, as we know, we really want to keep people out of those right now, especially those who are so vulnerable. We know there aren't any easy cuts. We want to be helpful, but we oppose any cuts that inhibit our community's response to this crisis. Thank you for hearing these comments.